Good morning from, would you believe, Manhattan? Uh, Good morning from my studio. The title of this video is Can Psychiatric Diagnosis Be Fixed? Uh, well, psychiatric diagnosis for the past 70 years has been mainly about a publication called the DSM. It first came out in 1952. It changed the whole game of clinical psychology because before that, uh, every school of thought had their own vocabulary about mental mental health issues, clinical conditions, disorders, whatever you call them. So there was no lingua franca. There was no common language, and as a result, I think, I mean, I wasn't there. I was still in diapers in 1952, but I expect that it was probably impossible to compare the publications of people in one school of thought against the publications and research of people in other schools because you'd be comparing apples and oranges. There was no agreement on even the meanings of the words. Well, in 1952, a psychiatrist named Spitzer addressed the problem, uh, and I hear it was kind of a superhuman effort getting all these people with vastly different ideas to agree on common definitions, but he did. It was the DSM, the Diagnostic and Statistical Manual. Uh, Now, about the question, it was a game changer, but there are many problems with psychiatric diagnosis, uh, and I'll briefly refer to those problems. Uh, I believe the DSM or diagnosis can be fixed, but it'll require a radical departure from business as usual. Uh, Now, the medical doctors have total control over the diagnostic categories, so that, for example, therapists are forced to use those definitions, those clinical labels, uh, at least for the client to file an insurance claim. The medical profession, I think, is deeply conservative, except perhaps when physical survival is at stake. But in clinical psychiatry, it's not a life and death matter. So typically, so the stance is conservative, which may be the reason why the overall approach hasn't changed in 50 years. So I'm going to start with the definition of diagnosis. I'm going to briefly discuss the limitations or flaws of the DSM. I may address the reasons why it's difficult to fix them. Finally, I'm going to mention how computer science, AI, and functional MRI data can possibly bring about a breakthrough and lead to a more meaningful, relevant, and human vocabulary for the things clinicians try to help with for the so-called disorders. So what is diagnosis? It's a scientifically motivated method, modeled after the scientific method, for understanding specific medical cases patients and their complaints, you might say, in support of treatment planning. The DSM is now available in its fifth edition, fifth major revision. Diagnosis has its origins in the treatment of physical disease, and it often works very well in that domain. It raises medicine above the level of guesswork, speculation, and magical thinking. Diagnosis can be appropriate. It involves viewing the body of the physical diagnosis. Involves treating the patient's body almost as if it were an object or a machine, a system of chemistry and biology. Now, when you try to view a person's mind or the entire person as a system governed by mechanisms, well, that can be harmful. One thing that I like to point out is that labels in the DSM, like personality disorder, well, that's better than what we might call the same condition on the street, where we might simply say that person is an asshole. It's better to say they have a personality disorder. It elevates the discussion above the realm of morality. For example, the diagnosis of alcoholism, it takes a lot of the shame out of the situation, because it's a disease, not a moral failing. Also, diagnosis can inform somebody's search for other people with the same problem. That facilitates finding help and support. The 12-step fellowships, of course, are a prime example. But it's easy to criticize psychiatric diagnosis, especially if you look at it through a historical lens. Homosexuality, for example, was classified as a disease. If you look at it through a multicultural lens, you can find faults where the DSM has kind of an American bias. If you look at it from any diversity-informed perspective, there are issues there, like neurodiversity is treated as a disorder. The social justice people also can find things to complain about. Another thing is diagnosis. It's stigmatizing. It says there's something wrong with a person, and that stigmatization causes a lot of people not to seek that kind of help. For example, in the past especially, but maybe even now, male-identified people, boys and men, are sometimes socialized to with a value of independence, even that seeking help and in some circumstances is unacceptable, a sign of weakness, inviting rejection. This is also influenced by certain military traditions, I'm told, or well, I've witnessed it. I'm not a veteran, but I witnessed secondhand. The value of independence and strength can be distorted and cause people not to seek help. And not just military, but also I think in some traditions around law enforcement, and probably a lot of other areas as well. It's said that doctors themselves are often reluctant to seek help. All of this is, amplified or enforced by the use of stigmatizing diagnoses. Finally, the DSM is agnostic with respect to the actual mental processes going on within the person. It's based on symptoms, and so the conditions are kind of opaque. You can't really look inside them and see what's going on. So I'm not going to elaborate on these criticisms. It's far easier to find fault than it is to propose a remedy. If you're interested, I'm sure on YouTube you can find many elaborations of these criticisms. But progress is possible. The DSM can be viewed as sort of a one-dimensional, categorical mind, a model of the mind, specifically the troubled mind. The remedy is flexibility and richness, a better model. That'll let us transcend its limitations. A little progress has been made. The latest version, I think it is, the DSM-TR, has something called dimensional descriptions of personality disorders rather than simple categories. And autism is widely accepted to lie on a spectrum rather than being a category that you're either in or you're not. So it's a start. Well, I want to go much further. Functional MRI, it's a special kind of a brain scan where certain structures light up depending on what the person is doing. Other structures light up when the person is idle, and gives a direct, structured, quantitative view into the brain that reveals some of the parts and what they do. Like the amygdala, which is the gatekeeper of fear response and helps determine whether we fight or run away or freeze. It helps determine the response, at least conditions the brain to respond in one direction or another. But there are a lot of known structures. So it can produce models. We can try to predict MRI data, and that'll guide a richer and more realistic and detailed model of the brain. I hope that if somehow I can find a way to adjust to graduate school or find some other avenue that I'll be able to work on this. Maybe as part of a team. There are cognitive neuroscientists. There's one, his name starts with P. I've got his papers. I don't remember his name. The pioneer is someone called Damasio. Well, anyway, that's my hint at how the DSM, how psychiatric diagnosis can be fixed. I invite you to put your comments below, your ideas, because I can't, figure it all out myself. So put your comments in the below the video, and please click like. I need YouTube's algorithm to welcome me, to be active. Finally, you might look at me and think, hey, this person might be transgender. Well, there are a few people who want to say something nasty. If you do that, it'll actually increase my income because it'll produce drama and controversy and more comments, and YouTube will channel traffic, will direct traffic to my channel. So you're actually going to help me by saying something harmful or nasty if you choose to go in that direction. At any rate, even the people who do that, I'm gonna I'm not gonna return your negativity. I'm gonna channel loving kindness and warmth just to frustrate you. Thank you.